Trans fats are primarily manufactured by industries to increase the shelf life of products, which pose significant hidden health risks. Dr. Charles Oyo says solid trans fats are harmful and are linked to various diseases.
These fats can also block those small blood vessels that supplies the heart itself. So in the long run, the heart gets compromised, the entire circulation gets compromised. And this one leads to heart attack, it leads to raised blood pressure or hypertension, among others, can also lead to stroke. So these conditions, as we know, they're very dangerous, they kill. And already in Uganda, heart diseases or cardiovascular diseases, these are diseases of the heart and the blood vessels, is the leading cause of death among the non-communicable diseases in the country.
This has triggered regulatory agencies to propose standards and regulations to mitigate trans fatty acids risks.
As Parliament, there still is a role to see to it that we provide effective oversight, post-legislation oversight, as well as ensuring that ministries, departments, agencies, local governments, and the whole of society complies with the legal and regulatory frameworks, the rules that have been set, the standards, and so on. And this requires partnership. And finally, through the Parliamentary Forum on Nutrition and Food Security, we've taken it up upon ourselves to see to it that we're involved in high-level advocacy on the prevention and control of trans fatty acids in Uganda as part of the broader framework for the regulation of foods. Food safety is important for us.
Dr. Charles Soyo says trans fats sold like butter can block blood vessels when consumed.
How can we prevent? Is to avoid or to limit access to this dangerous foodstuff, to limit availability of these commodities, to limit the consumption of trans fatty acids. And this is best done through a regulation or through some standards that has been put in place to control the amount that is put in the foodstuff that we eat, especially those ones that are manufactured by industries and are made readily available to the consumers in our supermarket. And that is why we are here. So we are in the process of consulting and agreeing with our stakeholders on the best way forward, because
the increasing burden of non-communicable diseases threatens to surpass infectious diseases as the leading cause of death in the next 10 to 15 years, and reducing the availability and consumption of trans fatty acids is essential to protect the public health.